Here's the tip. If you're diabetic, you need to look at your foot every single day. Every single day. More especially, or more importantly, if you're a diabetic and you have a history of amputations, you got to look at your foot every day. If you're diabetic and you've had wounds on the bottom of your foot, you absolutely have to look at your foot every single day. I just had a longtime patient of mine. I've been seeing this man for 7 years. We've been through a lot together, a lot. And we have saved some toes, we've lost some toes, but ultimately we've saved his foot. And he knows this, and he knows this. He just came in, he has a wound. And what's even more painful is I was going to perform a procedure to try to prevent this wound from happening because I knew it was going to happen. He had a prominence in an area that was causing a callus. And I said, we need to remove this pressure so that this callus doesn't form. And if this callus doesn't form, you would potentially not have a wound. Unfortunately, the insurance denied it. The insurance denied. We put authorization in, like, yes, it's preventative. Yes, he doesn't have a wound now, but we're trying to prevent it. They said no. Molina, I'm calling you out. Anyways, unfortunately, they said no. Now he has a callus. He comes in today. Y'all, I can't show it here because then TikTok's going to disqualify this video. They've been doing crazy stuff to my posts these days. Now this patient has a wound that goes from the bottom. Let me show you. From the bottom of the foot here, it went all the way as an abscess and this entire toe to the top. There's like fluid everywhere. It's infected. I put a little Q-tip in there. It's hitting the bone. It's going, it's bad. So I just had to send this patient to the hospital. I've known this man for 7 years and we've been doing good. He comes for his follow-ups every 3 to 4 weeks, but they denied it. But he also had a part in it. I said, when did this start? He said, well, I didn't know when it started, but I noticed I started having pain a week ago. And then I went to the hospital. So it didn't start a week ago. It likely started way before. And if he had been looking at his foot every day. So we had a little talk. You have to look at your foot every day. He would have seen that something was going on. We would have caught it early. It wouldn't have gotten down to the bone. And I may not be sending him to the hospital. Look at your foot every day if you're diabetic. Wound, no wound, neuropathy, no neuropathy. Please don't play with it. Your toe, your foot is at stake.